Welcome to the Affirming Minds podcast, where we equip like-minded mental health professionals with a therapeutic toolkit that helps add to a more engaging, fulfilled, and effective mental health practice. Each empowering episode can stand alone as a continuing education pod course or a very valuable professional or personal resource with insightful expert interviews, practical resources, industry news, and lots of inspiration. We help the modern therapist thrive at work. Now let's welcome your host, a dedicated therapist and passionate educator, Shaina Siber, LCSW.
Welcome to the Affirming Minds podcast. I'm your host, Shaina Siber. Today's episode is eligible for continuing education credit. To earn credit, visit affirmmentalhealth.com and join our membership, where you'll get CE access for our podcast episodes, plus workshops, self-study courses, and so much more. If you're already an Affirm Academy member, simply log in through the portal or use the link in the show notes to access the post-test and evaluation. Once you complete it, your CE certificate will be emailed to you within minutes. If you enjoyed this episode, please take a moment to leave a 5-star review and comment on Apple Podcasts or Spotify. It really helps other listeners find the show and join our affirming community of learners. A quick reminder before we begin, this podcast is for educational purposes only. If you're in need of mental health treatment or clinical supervision, please reach out to a licensed professional in your area. All cases and client stories described in this episode are de-identified, vignette-based, or composites, and no protected health information is ever shared. Music can comfort us, move us, and even help us heal. But for some people, music can also provoke anxiety or fear. A single lyric, rhythm, or melody can stir intense emotion or trigger distressing thoughts. Music is emotional memory. It connects us to moments of joy, heartbreak, and grief. And in therapy, it can become a bridge between emotion and expression. Music therapy has long been used in clinical practice to support mental health, helping clients express emotion, regulate mood, and strengthen mind-body awareness. Research using neuroimaging shows that music activates the limbic system and the brain's reward circuitry, increasing dopamine and decreasing cortisol, biological markers associated with stress regulation and emotional relief. Meta-analyses in journals like Psychology of Music and Frontiers in Psychology have found that both receptive and active music interventions reduce anxiety, improve sleep, and enhance overall well-being across clinical populations. Physiologically, rhythm and melody promote parasympathetic activation, which helps lower heart rate, blood pressure, and perceived stress. Clinically, music therapy has demonstrated efficacy across trauma recovery, dementia care, depression, and palliative contact, not only easing symptoms, but restoring a sense of connection. Music taps into something universal. It gives emotions a voice. In today's episode, we're focusing on how music can also play a surprising role in treating obsessive compulsive disorder, or OCD, through exposure and response prevention, or ERP, the gold standard treatment for OCD. For those newer to this area, OCD is a condition where people experience intrusive, distressing thoughts called obsessions and try to neutralize that anxiety through repetitive mental or behavioral rituals called compulsions. ERP helps individuals gradually face the things that trigger their anxiety while resisting the urge to engage in those compulsions, teaching the brain that distress can rise and fall naturally without avoidance. My guest today is Desiree Untch, LCSW, an independently licensed clinical social worker with expertise in treating anxiety disorders, OCD, and related conditions. Desiree has received extensive training in cognitive behavioral therapy and exposure and response prevention and completed the International OCD Foundation's Pediatric Behavioral Therapy Training Institute. She's a professional member of the International OCD Foundation and serves as the Vice President and Social Media and Public Relations Chair for OCD Midwest, where she also sits on the Education Committee. Driven by a passion for helping individuals manage worry and intrusive thoughts, she empowers clients with practical skills that help them reclaim their lives and fully engage in the present moment. In her conversation, Desiree shares how for some clients, OCD can even create fear around music itself, particularly when lyrics or sounds become tied to morality or religion, a presentation known as moral or religious scrupulosity. It involves intrusive fears about sinning, blasphemy, or being bad in the eyes of one's faith, and can make something as simple as hearing a song deeply distressing. We'll also talk about how music, with its emotional resonance, can be used to approach avoided feelings like sadness, loss, shame, and grief, helping clients reconnect with their emotional world instead of retreating from it. Even if you don't specialize in OCD, this episode offers creative ways to think about music integration more broadly, using sound and rhythm to deepen emotional processing, enhance exposure work, and gently reduce experiential avoidance in therapy. Before I get to my interview with Desiree, let's take a quick look at the research connecting music and exposure therapy, because while this is still an emerging area, the science is really compelling. ERP is grounded in emotional processing theory, which teaches that anxiety decreases when we activate a fear structure in a safe context and stay with it long enough for new learning to occur. Music can support that same mechanism. It evokes strong emotion, encodes memory, and facilitates physiological regulation, all ingredients that enhance exposure learning. In one small experiential study, researchers found that neutral background music during exposure to phobic stimuli reduced distress without disrupting fear extinction, suggesting that for some clients, music can actually make exposure more tolerable without weakening its effectiveness. Other studies, like Shathan et al., show that certain tempos and rhythmic structures promote parasympathetic activation, helping clients stay grounded during emotionally activating tasks. Conceptually, ERP and music therapy share a core focus on approach and engagement. In ERP, clients learn to turn toward what they fear rather than performing compulsions or avoiding. In music therapy, rhythm and melody invite a similar process, engaging with sensation and emotion that might otherwise feel overwhelming. Both rely on graded exposure, emotional regulation, and meaning reconstruction. Clinically, music can be woven into ERP in multiple ways. For clients who fear particular songs or genres, those tracks can become in vivo exposures, played intentionally while practicing response prevention. For others, music can support interoceptive exposure, helping clients notice and tolerate physiological arousal like a racing heart or muscle tension. There's also a growing interest in music's role in inhibitory learning. Because music evokes vivid emotional states, it may help the brain encode new, non-threatening associations more effectively. Now, it's important to note that there are no large randomized controlled trials yet, specifically on music-assisted ERP. Much of what we're discussing draws on validated evidence from adjacent fields, affective neuroscience, music therapy, and exposure learning research. The integration you'll hear about today represents an emerging evidence-informed approach, one that combines creativity and science to enhance engagement and generalization. If you're new to ERP or OCD treatment, I highly recommend checking out our self-study webinar, From Rituals to Recovery, an Introduction to Exposure and Response Prevention for Obsessive Compulsive Disorder, with presenter Melissa Daftis. Available now at affirmmentalhealth.com and included in our Affirm Academy membership. It's a great primer before diving into this episode. You might also enjoy our earlier Affirming Minds podcast episode, Treating OCD with Purpose, Harnessing Values for Effective Exposure Therapy, and our episode on virtual reality and therapy, which explores how immersive technologies can enhance exposure and engagement. But for now, let's turn up the volume and dive into this conversation, exploring how music, emotion, and creativity can transform the therapy experience. Desiree, thank you for being here on the Affirming Minds podcast. I am just so grateful to have you here today. I feel like this is going to be a really fun conversation. Could you start by introducing yourself to our listeners, share a little bit about your background and how you came to work with OCD and ERP, how music could become part of your clinical approach, all the things. I want to hear it all.
Yeah, thanks for having me. I'm really excited to be here. So my name's Desiree Untch. I am a independently licensed clinical social worker, and I'm also the owner of Aspire Anxiety and OCD Solutions in Canton, Ohio. I really think my specialty found me. For me, it's been a labor of love. I really enjoy treating OCD, and I got started specializing in it around COVID, which I know it seems like a fever dream. COVID was like 5 years ago. I had the luxury of learning about OCD pretty early on in my graduate studies. And I knew at that time I wanted to go into private practice and I wanted to treat mental health conditions. After I graduated and I was doing some part-time therapy on the side, I decided to shift gears to private practice, and I worked at a private practice locally in Canton. I saw all sorts of different diagnoses and age ranges. And one thing that I did notice was there were a lot of individuals coming to me misdiagnosed. They were diagnosed with different anxiety disorders. A few people were misdiagnosed with psychotic disorders, and they actually had OCD. Ironically, around the same time, my brother really started struggling with OCD as well. And so I was actually trying to navigate how to help my brother and what's the treatment for this, and also how to help my clients, because I wasn't trained at that time, but I knew there was specialized care that was needed. At that time, I was actually in a consultation group that my previous professor led. She's still my mentor today. I'm so thankful for her because everything as a clinician, I really do owe to her. She helped me get connected with a lot of amazing trainings, and I learned how to implement exposure response prevention. Before I opened my own practice, I ended up actually leaving that private practice and going to her practice counseling group. So I worked there for about 2 years prior to opening my own. And when I was at Palladium, I noticed I had a handful of clients avoid music or certain themes of music. And I thought, oh, this is interesting. I always have found it very fascinating the way that OCD shows up for different people. And while there are some common flavors or themes of OCD, it really tends to attack what people value most. The presentation feels so individualized, so the treatment is also individualized. And I've really enjoyed being able to get to know my clients and see how can we individually tailor ERP for in the way that OCD presents itself. I think that avoidance is really a hallmark feature of OCD. We don't always consider that. I think compulsions are just fancy ways that we avoid, right? And if we're looking at it from an opposite action point of view, the best thing that you can do is approach anxiety. And so I started to utilize music because naturally, if someone's avoiding it, let's do it. Let's face that fear. Let's confront it. And I noticed amazing results. And I love to be able to see, like, how can we bring creativity into ERP? Exposure therapy, I think, gets a bad rap sometimes out in the community, and it's very stigmatized. So being able to pull in creative interventions and making it feasible too, because music really is everywhere, right? You go to the store, you ads on TV, commercials. Music really is everywhere and it's universal. So being able to make ERP also tangible for people, we want to make sure the exposures we're doing are appropriate and make sense. So there were a couple of different ways, but that's how it came about briefly.
Can you clarify when you say that there were some folks that were avoiding music and that it sounded like that was like a clinical manifestation to their OCD? What did that look like? And what did you notice about, because it sounds like in that case, the music itself is the exposure work. And it also sounds like you're thinking how to creatively infuse ERP with maybe some different sort of sensory experiences and things that are going to make it more engaging because of maybe some of that bad rap that I think maybe for people outside of the OCD and ERP community, the thought is maybe experiencing it as like a harsh treatment. Maybe they have these very specific images of, I don't know, those old talk shows where they would bring out, oh, somebody was afraid of birds. So they have birds on olive and then flood the person and just see their response. But can you speak to a little bit of where that clinical association of music coming up as a clinical sort of target?
Would it be helpful to dive into ERP as well and what that looks like? What you're describing is definitely flooding. We don't want to flood people, right? So we're not chasing them with our exposure material. We want exposure to be a consensual thing and a gradual treatment and protocol too. Yeah, we know that exposure response prevention is, we call it the gold standard treatment. Essentially, it's a first line treatment, right, for OCD. And there's two main components. There's the exposure piece where we activate that fear structure that is underneath the core of the OCD. So what the core fear is, and your exposures are going to be targeted and created and crafted surrounding that core fear. And then the response prevention piece is we want to essentially resist engaging in those compulsive behaviors that keep the disorder going or delay them, but ultimately we're learning how to resist. That's the goal. That response prevention piece is just as important as the exposure piece. I think sometimes we get carried up prioritizing that exposure piece, but the response prevention is just as important because it's what dismantles the condition. So we know that it works because of habituation, which means we get used to it. What once was maybe really challenging becomes easier with repeated exposure and more time. We also are able to learn new things and challenge feared outcomes.
So for those who are newer to this topic, can you just maybe walk us through really bare bones what OCD is and how it typically shows up in people's lives?
Sure, yeah. So OCD stands for obsessive compulsive disorder. So there's a couple of main components here. So we have obsessions, which are either intrusive thoughts, images, impulses, or urges that pop up. They are repetitive and they create a lot of discomfort or distress for the individual experiencing them. They're ego dystonic, which means essentially it doesn't align with that person's morals or values. It's not really in harmony with who they are as a person. So somebody with obsessions of, for example, harm, they may have those obsessions, and when they experience them, they're extremely distressed. It's not what they want to do. I've always said you are probably safest around somebody who does have OCD and experiences those thoughts because that is not who they are. It's almost like this third entity. It feels like alien almost when they experience these thoughts. The other component is the compulsion piece. Humans are wired for survival, just like how animals are, right? Like we have fight, flight, or freeze. So I look at it like with OCD, it's almost like this overactive alarm that's going off and saying, you are in danger instead of you might be in danger. And someone with OCD is trying to get rid of this distress and anxiety by doing a compulsive behavior. And that could look like a couple different things. So compulsions are mental acts or physical acts that we do to push away or eliminate that anxiety. And what happens when we do those compulsions is we experience temporary release, and it actually sends a message to OCD and that like fear structure that OCD is right and there is something to be afraid of. So there's meaning attached to that obsession and it essentially reinforces it. And
Do you think some of the misdiagnosis that is happening is because therapists aren't as attuned to some of the mental compulsions? I think a lot of folks could, if a client came in and reported contamination fears associated with knocking or moving furniture or something that was like very externalized and behavioral, that was an observable behavior, I think sometimes people can instantly catch it. I have experienced, even though I'm not expert in OCD, I think you work in community mental health long enough, you're going to see everything. And certainly I did run into folks that got very late diagnoses or in the mental health system a very long time without it being diagnosed. Or I saw quite a bit in the perinatal postpartum period where there was a concern about postpartum psychosis, but there wasn't that curiosity about it being egosyntonic or dystonic. And for many of these parents, that it was certainly dystonic. And that piece became the mental health interface became very distressing because I think those nuances weren't extracted. And then the other piece I see sometimes is I work with a lot of residents and people in healthcare. And I think some of the mental compulsions around reassurance seeking and behaviors that look like compulsive like checking in articles, checking the medical record again and again, because there's some contexts where a little bit of it would be normative, like when it's being done for hours and there's no stat, and it's very difficult to stop the loop of the intrusive thoughts and the compulsive behaviors. I think those are also some of the maybe they fall more into those mental exercises, because it's not necessarily that the behavior is inappropriate to context, but the severity of the behavior is inappropriate to context, if that makes
Yeah.
sense.
Yep. I totally get what you're saying. And I will say, I think misdiagnosis happens for a couple of different reasons. I'm actually prepping for a presentation later this year, and some of the research says that OCD is the third most common misdiagnosed mental health condition. And I think it's very believable. I think there's a couple different reasons. Those mental compulsions are really tricky, right? I think we think of the physical compulsions when we think of OCD, right? But I would say most, if not all, of people, who have OCD, they're doing mental compulsions. Typically before physical compulsion, sometimes there's mental compulsions before that, right? Whether it be backtracking, did I touch this? That mental review, the hypothesizing, thought neutralization. There's so many different mental compulsions. And if you're not asking about it, your client might not report it. Because if you think about it too, like this is their normal, right? This is how they're experiencing the world and their thoughts, right? And so I think too, a lot of times as people, and I think this comes into touch with the reassurance seeking, we're very kind of reassuring, oh, it's going to be okay. And telling ourselves like, oh, it's going to be okay. That's not going to happen. It's going to work out, right? When we have to make room for the possibility with OCD, and whether it be like self-reassurance as a compulsion or even physically seeking out reassurance from somebody else, all it does is reinforce that obsessional doubt and reinforce OCD. I also think too, I think people think OCD is hand washing and being clean. And I think people confuse it sometimes. And I think it's partially the media. It's very stigmatized. It's not a preference. And I'm glad to hear as well that you're considering ego syntonic versus ego dystonic, because I think that's so important and crucial. We need to be able to understand how our clients experience thoughts and see if there is a functional relationship with those ego dystonic thoughts. Because I always think of it like, can I plug it into the OCD cycle? And does it fit into there? And if it looks like a duck and it quacks like a duck, let's treat it like a duck and let's do ERP.
It's been an unfortunate thing that obsessive compulsive personality disorder is so closely named to obsessive compulsive disorder, because I do think most media representations of OCD, not to age myself, but like Monica Geller from Friends, I think a lot of people have that sort of a type A, extremely obsessed with cleaning and organization, and that sort of being the archetype of OCD. And I think a lot of people even self-reference like, oh, I'm so OCD about the, and they're talking about being meticulous or being highly organized, and just recognizing how painful this is for OCD sufferers. I think it is one of those areas where then unfortunately, I think a limitation of the DSM got absorbed into the vernacular of the general public in a way that's spread misinformation, unfortunately. Yeah, no, I could really understand how that becomes like probably a space to debunk, and where there's been a lot of misinformation. Could you just really briefly give us a little bit of an overview of what ERP is?
Sure. And one more thing too, while we're discussing mental compulsions, I look at it no matter what the compulsion is, it's still functionally doing the same thing for the OCD. Some people wash their hands, some people wash their minds. And it's that aspect of avoidance that keeps it going. In terms of ERP, exposure response prevention is the first line treatment for OCD. So essentially what we do is we want people to learn to confront these core fears that are the underpinnings that keep OCD going. All behavior is functional and it serves a purpose. So it's really important, especially in OCD, to understand what the function of the compulsion is and what is that meaning or message that he's saying is going to happen, whether it be if I don't do my compulsion, my loved one's going to die. or I'm going to go to hell, or I'm going to catch whatever illness. So we want to understand what the core fear is and really get down to the nitty gritty. Once you identify that core fear, your exposures are actually going to be crafted to target that core fear. And then we do that response prevention piece where we essentially want to resist engaging in compulsions or teach people different response prevention strategies to delay and then eventually resist, because what we do not resist persists. There's a couple different types of exposures that we use in ERP. The first one's in vivo. So in vivo exposures are essentially like in real life. So these are exposures that we can do in session or someone can do tangibly at home. So if somebody, for example, has harm obsessions about harming their loved one, for example, sometimes people will avoid sharp objects or put them sight lines so they don't have to confront that. Can we put those knives back into the butcher's block? Can we hold a knife in session? You want to do gradual exposure, but just some tangible in vivo exposures, confronting it directly. It's going to look different depending on the theme, of course, but sometimes there's tangible ones too. If you're using your sleeve to touch a doorknob, can we confront it directly and touch that without engaging in any safety behaviors or compulsions afterwards? Imaginal exposures are another way that we utilize exposure. So imaginal exposures are essentially, if we cannot make it happen in real life, we can essentially be creative and write about it. That might look like uncertainty statements. We're making room for that possibility, or essentially you're writing a story that has no happy ending. We're confronting that fear directly and listening to it over and over. So there's some ways to do imaginals, but that's the gist of that.
We had Ronick on and Melanie Smith utilize virtual reality as a mechanism to do imaginal exposure work, which I think is also a really interesting way. I always say that folks working with OCD, or really anyone who's doing exposure-based work, are just so creative in ways that they do this. But speaking of creativity of the exposure therapists, I think, of course, one of the reasons I was really intrigued about having this conversation with you today is your incorporation of music into ERP. What sparked that idea?
Yeah, that's one of my favorite things about being exposure response prevention specialist is that I have the ability to be creative with my clients. And I always loved music and I just like to find ways to bleed it in. So when I was working at my mentor's practice, a handful of my clients actually had different compulsions around music from what I noticed. I had some people avoiding certain genres that were tied to different core fears of theirs. And I actually even had a couple clients who would come in. We had a radio play in the waiting area along with some sound machines to turn down the noise or neutralize the noise in there. And I had some people who would turn off the radio. And I was trying to figure out who's turning off the radio because I'm getting my clients, bringing them back. And then it came up in session. A couple were turning it off for one reason or another. A client in particular was actually fearful that they would hear certain language that would activate some moral scrupulosity that they experienced. They had some core fears surrounding going to hell. And hearing profanity for them was like emotional contamination, like feeling dirty, and then would cause to engage in compulsions afterwards or just flat out avoid. And seeing how impairing it was too for some of my clients was pretty eye-opening. I had several clients who were avoiding certain stores, ordering Insta pickup for their groceries because they didn't want to hear the music the store was playing, not going to loved ones' birthday parties because of fears associated to music, skipping on Spotify when you can, but you're out of luck, right? If you run out of skips, right? Having reactions to music. So I thought that was really interesting. And I've always been in the mindset of opposite action. We need to find ways to approach what makes us anxious. And I think that's especially true in terms of ERP and treatment of OCD. So I was actually talking to my mentor about it and she thought it was a great idea and I ended up doing it with.
I think it's really interesting to you're saying about for those people where music does get tied up in elements of their intrusive thoughts or their compulsions, how limiting that must be. Because when I was a child into adolescence and probably into early adulthood, I had a pretty intense phobia of clowns, but you pretty much survive your life without having many run-ins with carnival-looking clowns. But to your point, that music is just so universally part of our experience. So if that is something that you're meant to avoid, how small your world then becomes.
Yeah. And that, I think, I hear a lot. People's worlds become so small because of OCD. And one of the things I think I love the most about ERP treatment is that it's effective and it can help expand people's worlds and do the things that once brought joy or that they couldn't do before. And seeing your client become more confident over time and, oh, I can go grocery shopping now without leaving, right? My cart in the middle of the aisle, or being as anxious the whole time. Because the thought itself or the fear itself isn't the problem. It's the reaction, right? I do think it's something that's tangible. I've always thought that ERP is a lifestyle approach. It's not just a treatment modality. But if we can learn to confront our fears or face the things that make us anxious, it's going to help. It's going to help you with your OCD. It can help you with your anxiety. I think people learn through experiences, and there's so much to be learned when we can willingly confront our fears.
Yeah, absolutely. Absolutely. Make contact with that. I think it is really empowering. Now, are you really focusing on integrating music when there is a clinical target that is rooted in avoiding music? Or are there other ways you're using music to amplify ERP, even if that's not woven into the OCD, like intrusive thoughts or compulsions explicitly?
Sure. Yeah. And that's a great question. If I have the opportunity to leave it in, I will, just because I enjoy it. I think it's fun. The clients actually tend to enjoy it as well. And I think too, there's like a sense of autonomy that they get from picking what goes on their playlist. And I think a lot of times when you struggle with OCD, you don't feel like you're in the driver's seat. It feels like OCD is driving the car, right? And as much as I can, I want to make ERP this like collaborative process, and being able to tie in music and say, okay, we're going to make this exposure playlist and we're going to pick some songs. I'm going to let you pick out songs. So like, this is the theme that we're sticking with. I think people feel empowered by it as well. So I think it's really neat. Now, if it's not exactly an avoidance aspect or directly correlated with the obsessions and compulsions, there are times where I leave it in a different capacity. So I'll give you an example. In the past, I had some clients who struggle with death-related core fears and obsessions, fears of dying. And I do some imaginals with writing your obituary or your eulogy, right? But then there's this music aspect where I'm like, what if we made a playlist that you would play at your own funeral? Could we plan our funeral in a way? And I've had clients who will make the funeral playlist, which sounds morbid, but we have a lot of fun doing things like that. And I have a dark sense of humor, and I'm like, oh, it's less stuff you have to plan later.
But I think introducing levity where there may be so much heaviness and so much distress, it sounds like that also is a benefit of thinking about moments of music integration. And I do a lot of acceptance and commitment therapy. And one of the principles of acceptance and commitment therapy is reducing experiential avoidance through acceptance techniques and being connected to the present moment. For a lot of folks, simply being with themselves is so uncomfortable, right? Just generally being in their own skin, being in their own body, being present with their own thoughts and emotions. So I think oftentimes when we start thinking about mindfulness, like that groan, as a lot of people anticipate with maybe having the clinical language, that they're going to get kicked out of their window of tolerance. They're going to be overwhelmed by the experience. And I think sometimes things like music, listening to a song and fully listening and really hearing it in a different way and being present in that way can oftentimes be a really soft entry point in, because so many people, music means so much to them. And it also can be such a intuitive way to shift your energy and your mood for folks.
Yeah. And while it can be a soft entry, I think it's important to point out not everybody might experience that way, depending on where their distress tolerance level is at or anxiety sensitivity. So in the past, I've also had clients make like multiple playlists, ERP next level playlists, and then like kind of daily playlist, right? And they've added maybe more activating songs as they strengthen that ERP muscle and build that challenge up. So that's another option too. If it feels maybe more intense for the client at first, you can definitely break it down like it's its own hierarchy in a way. Yeah, I also use ACT, and I think ACT is a fantastic add-on for ERP. One thing I will say, I like to tie in ACT sometimes with the music aspect as well with ERP, because when we're thinking of ACT and expansion, right, you're making room for that experience. I want to know what's coming up for you. Does it feel like? What urges might you feel? Do you have that urge to skip that song or just turn the playlist off? What are you feeling in your body? Are there any memories that come up? Because think about it, you hear a song, you might think, oh, I was at this grocery store, I was at a birthday party. Music brings back memories for different people. It can be very nostalgic. And I think too, what I've also noticed is it's not just anxiety and distress that might pop up. It's also sometimes grief, right? If you think about how small someone's world might become as a result of OCD, there's sometimes grief and lost time, right? And missing out on life experiences because of OCD. I always look out for not just that anxiety, distress, discomfort, or disgust that pops up with OCD. We want to look at the whole spectrum of emotions. And so I like to utilize ACT just to expand on that with the client and be on the lookout as well.
Yeah, absolutely. That's really helpful to think about. So you're talking about how music can potentially enhance exposures. Do you find that there's any particular genre, rhythms, lyrics that you are wanting to introduce to the clients? It sounds like you really try to tailor it, that like a lot of it is about knowing and understanding the client, but like maybe for someone who doesn't know where to start and what were some of the things like you were thinking about when you're integrating music into this work?
Yeah. So I always consider the core fear, of course. And I can give you an example. I once had a client who rap music was really activating for them. They were very avoidant of rap music or any radio stations that might play beats that even might replicate that, because they were fearful if they listened to the music. And a lot of rap music talks about drugs, alcohol sometimes. And they were concerned, if I listen to this, that I'm gonna use drugs or I'm gonna start doing those behaviors. So there was a bit of magical thinking and then an element of emotional contamination that came with listening to that music. And so being able to recognize what might work for that client, I think is really important. I have noticed too, some people are either like for country or not country. I think too, the aspect of language, and sometimes it's slower, like the newer pop country. I think it's a little fast paced now on the radio, but sometimes that slower beat and draw out almost as the rug's going to get pulled any moment, right? For some people. So I think different things come up for different people. Some beats that are quicker. For example, I'm thinking of, I think Halsey has some really great music that kind of has, I don't want to say spooky undertones, but I don't know, haunting undertones where it like bleeds into kind of themes of religion or like religious scrupulosity. And so I know her song like Lilith or Bells in Santa Fe, those have been really helpful for some of my clients who have scrupulosity core fears, or Judas by Lady Gaga. Some of the content and the lyrics can be really activating, but sometimes it's the beat too. I don't know if you know the song like Demons by Doja Cat. I've had a handful of people say just like the intensity of the beat build, and there's so much going on in the song, it wasn't even the lyrics. There's just too much happening. So I think you can pull at different strings with music. And I would ask your client too, what would provoke more anxiety, the lyric itself or the rhythm and the beat of it, right?
Yeah.
And I think too, considering like what compulsions someone might do. So, for example, one of my clients, a couple of them in the past, kind of avoided earbuds, right? Because it felt too intense. It spiked anxiety. Having a speaker in my office to listen to different songs, then working your way up to can we listen to the song in our earbuds without pausing or skipping the song? So there's definitely different beats. I think it's different. I think every song is so different and new music is coming out all the time. So there's so much content to pick from, which is really exciting. When my colleague and I went to IOCDF and did a youth activity where we created an exposure playlist and taught them how to go about doing that, we came up with a Spotify playlist that was like 14 hours of music. So there's definitely a lot out there that you can pick from. And even when I'm listening now, I'm just like, okay, what can I add to the playlist for if I think it might help a client, I'll add it to the playlist essentially.
Yeah, no, it's interesting too because my wheels are turning that even just that idea of getting people in contact with what they're avoiding. And even for people who may not meet full criteria for OCD, I work with a lot of people where it's experiential avoidance. They're organizing their whole lives because shame is such an intolerable emotion for them, or guilt is such an intolerable emotion for them. And music, I think, is a great access point to emotion and an emotional depth. So I think they've been avoiding their experiences of loss. Speaking to that nostalgia and that music can really, teleport us in some ways to another time, to memory in a way that may be much more sensory and engaging that maybe we can't always access just by verbally talking it through. I think some people are better at that, of narrating things and bringing things top of mind. Some people are better with visual imagery, but some people struggle with that. So I think the more options that we have to connect people, and I can see that being really important, like a possibility for doing some of that experiential exposure when sometimes accessing memory and that might cultivate internal feelings that the person may be avoiding.
Absolutely. And I think it is a sensory element, and you can even kind of add on and build to music. So it's not just listening to the music, but how can we kind of amp this up? So, for example, if we're listening to music with of harm, for example, can we listen to it in the kitchen while we're cooking and utilizing sharp objects and knives, right? Or can we listen to it in the presence of maybe the loved one that we have intrusive thoughts about with our earbuds, or a church parking, right? If we're targeting some scrupulosity, right? It aligns with the core fear, of course, but there's different settings that we can pull from, even a cemetery, right? Different places are going to activate different core fears. And I think adding music on top of that, it can really enhance the whole experience. I think ERP. So I've also found some luck doing that too. Or if it is the avoided place, for example, whether it be the grocery store or whatever, can you go to the parking lot and listen to your ERP playlist? It's empowering for clients because it's tangible, right? I'm going to listen to this playlist before I go into that store. It's like a build, right? Next time I go here, I'm going to go inside. And it's really cool to have your clients come back and as they get better. I was in Panera the other day and I was able to stick out the whole time without leaving, and one of the songs came on my playlist and it was fine. It's really cool to be able to hear stuff from clients and they feel confident and excited in their growth too.
Yeah, absolutely. And what's interesting, you talking about like the moral and religious scrupulosity like coming up, because I have heard, I'm in Arizona now, New York, and there's a lot more presence of like high control religions as a clinical target here because they're just, it happens to be baked into some of the culture. And I think there is more explicit fears of listening to certain artists or songs where the tones are thought to be undertones like satanic or something. And so it's just interesting to hear you talk about almost music itself potentially being a contamination fear, that just hearing something is going to like you and by proxy make you sinful. It really is interesting about how explicitly it's being used in your exposure work. Yeah. So for therapists who are listening to this and have some curiosity, What would you say is like a good place to start? Are there any specific exercises or interventions? You mentioned like a playlist or cultivating a playlist. What does that look like in practice?
Sure. Yeah. I would say, obviously, we first of all want to make sure that we have training in ERP, right? Or active consultation as well. But I think it's really important, first of all, make sure you're hitting the right core fear. Because remember, it's not about the content of the OCD. OCD can target really anything. So once we clarify that core fear, we want to look to our music and see, like, all right, what songs or artists have some genres of music that kind of covers that theme. So, for example, if it's like relationship OCD, my first thought is always Taylor Swift. She has a wide catalog to pick from of different music that's about relationships that might activate some of those core fears, right? Or, like I said, some of Lady Gaga's stuff, different things to cool at. It has some good stuff, right? So, honestly, sometimes if I look at my playlist, but if I want to expand on it, sometimes like Google is a good search too. Songs about harm, songs about religion. You can see too what comes up. I always kind of look at like, all right, what's on the Billboard Hot 100? What's on trendy right now, and what can we kind of
Make it relevant. Yeah.
relevant and hip, right? I do try to see what's out there first. And then I also ask the client, do you know of any songs? And we fill each other in. I'll go through, I'll be like, this is what I found. And what did you find? And we compare. And then we pick, right? All right, this is on here. You don't need a ton either. Pick 10 songs, a couple minutes each. You're going to have a decent amount of time on there. And then you have them listen to the playlist throughout the week, right? Without engaging in compulsions or safety behaviors. And then you can change the playlist up a little bit. Are you ready to amp it up? And like I said, if it feels too intense, you can have a little sub hierarchy. All right, these are exposure songs this week. Next week, we're going next level, right? We're amping it up. So I would say it just depends on you and your client and what you guys think that you want to do and how to handle it.
I could also see it just being helpful intervention because it translates so well to the homework piece and doing some of that work independently between sessions because it's like a portable, accessible way to structure an exposure where, again, I think exposure therapists are so creative. They have to really be thinking about how to create this hierarchy in a way that is doable and accessible and can be replicated in different environments to maximize the benefits. So I can see using music as a tool can be a particularly powerful one because I'm sure for folks where it's thought to be helpful towards their core fear that it's something that most people can do. What have you noticed has been the response when you start to talk about integrating music into the work from clients?
Yeah, I would say that all my clients who I brought it up to have actually been willing, which I'm so appreciative of. And like a curiosity or, oh, really? A shock almost. It's not directly correlated to the obsessions and compulsions. So, for example, like a couple times I've made a funeral playlist. What would you play at your funeral? Oh, really? I never would have thought about doing that, which granted, if you're not in ERP, it might not be on the top of your to-do list. But I would say reactions have been really positive overall. And I think that it gives, like I said, it gives people that sense of autonomy to take over the driver's seat that OCD was previously in charge of. They're picking the songs, they're leaning into it. And I think it gives the client the ability to be creative. And I do think that individuals with OCD are very creative. In fact, I would say that the obsessions in OCD are limited by the sufferer's creativity, right? Since it can be about anything. So I really like to pull at people's strengths, and they're more of a creative or artsy person. Let's pull it out. How can we bring it into treatment?
Absolutely. Are there any like things that we should be cautious about or be mindful of when integrating music into ERP? Of course, you mentioned that having the foundational skills to appropriately and effectively deliver ERP is like going to be step one, right? For those folks that are there at that level, they are doing ERP, they're very comfortable working with this population. Is there anything they should be thinking of when applying this work that would be important?
Yeah. great question. I think circling back to what I mentioned earlier, I'm always surprised with what else comes up. With the music aspect, what other emotions come up as a result of music? Because it's not just like that anxiety, distress, discomfort, or disgust, right? Music can elicit all sorts of moods for different people or bring up different memories for people. So I think being on the lookout for that and considering too the small, subtle things that someone might do to push away discomfort, turning the music down a couple clicks, right? Or having to have the volume at a certain number, right? You want to be able to spoil those compulsions. So you want to make sure you're discussing that response prevention aspect with your clients prior to that exposure. What could you see yourself doing to push away that anxiety and discomfort and being on your A game about that response prevention strategy of how to spoil the OCD when it shows up?
Do you see music as a way to increase treatment adherence, especially for clients who may be resistant or have some concerns about starting ERP treatment?
Yeah, absolutely. So I do think that it gives people the ability to be creative and collaborative in their own treatment, and we're able to pull up their own strengths. And as I said earlier, I think ERP is a lifestyle approach, and I think music is so versatile and it is everywhere. It's on the radio, it's in the store, it's in so many different settings. And if we are trying to allow people to live a life that they value and aligns with their values, right? People want to be able to do the things that they used to do or they're not doing anymore. So I think too, tying in values work can be really effective, right? Whether it be sticking at the store, right, when the song comes on, or being able to go to a concert with your friends.
There's such a social component to music too that
Yeah.
I could see could be really isolating if people.
Absolutely. Yeah. I've heard a couple people say, "Oh, I really wanted to go to this concert with my friends, and I don't know if they're going to play this one song that's a trigger for them, right? Or activates their OCD, and it's holding them back." Those are memories that you could have with your friends, right? And so, how can we utilize ERP to help you get to that concert and be willing to experience that anxiety at the concert and still have fun, right? Because we can be anxious and you can still do the thing, right?
Yeah, absolutely. Where do you see the future of ERP going? And is part of it this like vision of having these creative modalities integrated? What are your thoughts on that?
Yeah. I'm interested to see. I'm not sure. I hope that more and more people keep utilizing creative interventions for ERP and utilize music. I will say when I went to IOCDF, there were a couple segments on creative interventions, and one of them did mention music. I was excited to hear that other people are using music in practice. And I think other ways too, like I know virtual reality is becoming more popular with exposure. I haven't yet tried that, but I'm very intrigued by it, and I'm excited to see what's to come. And I think that the more creative that we can get, I think it helps our clients, and I think that it also debunks some of the stigma around ERP too.
Yeah, absolutely. Before we wrap up, is there anything else you'd like our listeners to take away from our conversation today, whether that's therapists that are considering learning more about ERP, clients navigating OCD, or just people curious about the role music could play in clinical interventions?
Yeah. I hope people are willing to give it a shot because I think it can be really transformative in treatment. It's really cool to watch and I really enjoy it. And I hope that other people do too. I look at myself as a tour guide, doing the work with my client and along for the ride with them. It's really cool to see people reclaim a fulfilling life.
Desiree, thank you so much for being here. I think it's such an interesting area of expertise, and I love what you're doing with it. Can you tell folks where they can find you, where they can learn more about this important work you're doing? How can they connect with you?
Sure, probably my website is www.aspireanxietysolutions.com. You can also email me anytime, Desiree@aspireanxietysolutions.com. I think I'm on LinkedIn too, so you can probably find me there. I do have social media, but to be honest, I'm not the best at keeping up with my practice social media. But Aspire Anxiety and OCD Solutions does have Facebook and Instagram.
Fantastic. Thank you so much for being here.
Yeah, of course. Thanks for having me.
Thank you for joining our community on the Affirming Minds podcast. If you loved this episode as much as we did, please follow us wherever you listen to your podcasts and share it on your socials. If you want more information about how this podcast can add to your continuing education credits, visit affirmmentalhealth.com. And remember, let's affirm, heal, and grow together.